G'day Matt users and Matt crew. Here we are, coming to you live from the treadmill and also coming to you live from Penang. Those may not be aware, but I'm in the middle of training for the marathon at the end of the year. We've been over here in Penang delivering an awesome course to the iSports crew here in Penang. We spent 2 days running through how to use the mat to get more objective assessment data with the people that they work with, and then talk about strategies, obviously, for improving, the reduction of injuries, improving the rehabilitation outcomes with the patients that they work with, and also helping to improve performance. But I thought, since I'm in the middle of a run here, and I've got about another hour or so to go, good time to touch base with the mat crew and the mat users about what are some of the number one tests that we use utilising the mat as well as other objective assessments, particularly working with runners, because when we look at running as an activity, it's probably the number one, the most used or the most performed activity, because it's so accessible, right? People, all they have to do is pull on a pair of shoes and away they go, which is pretty cool. And particularly in a world where probably levels of health and fitness are decreasing, it's great to have things that are really easy and accessible. Lewis Jenner, how are you? Coming to us live. Nice to see you on the channel, mate. So one of the issues with running though is because it is so accessible, because so many people like to undertake it, and I think as well a lot of people have this thing about running, and particularly weight loss. They think it's like the be all and end all. Then the issue with that is that probably a lot of people that shouldn't be running necessarily are running. And the fact that when we run, and Rick Mirabella's on the channel, well done. So when people are not quite ready for running and they're doing a lot of running, particularly when we look at the data around ground reaction force, so how much impact force is going through not only the lower limb but the rest of the body, obviously the numbers are pretty high. When we look for the research, it's like 2 to 3 times body weight worth of force, right? So I'm an 80 kilo male. So for me, we're talking 160 kilos to 240 kilos, depending on how fast I'm running, has to go somewhere, right? Now, hopefully, in many cases, that's obviously being absorbed by particular the muscle tissue, right? Rick's asking me if this is my idea. No, Rick is my running coach. This was Rick's idea to get me on the treadmill. I'm having to go hard. So if those forces, 2 to 3 times body weight, if it's not being absorbed by that muscular tissue, in particular the active tissue, has to go somewhere else, right? And often then what we're talking about tendons, we're talking about ligaments, we're talking about joint tissue, we're talking about all the other connective tissue. G'day Christian, how's it going? So that can be a big problem, right? So, and often that leads to, I guess, a lot of the injuries that we see with runners, right? Not too many runners suffer from too many acute injuries, right? Unless you're sprinting or playing a field sport or something like that. It's not too much, or you're unlucky, you roll your ankle or something like that. You don't usually kind of do a tear to a ligament or a muscle so much when you're running, okay? Maybe sometimes, a few little calf niggles and calf tears, but they'd be pretty low grade. The vast majority of the injuries that occur, g'day Raya, how's it going? The vast majority of the injuries that occur in running are obviously repetitive stress type injuries, right? So too much stress and strain for what the body can tolerate, okay? And usually it's over a period of time, right? It's probably not going to happen on that first run, but as you're starting to get into it, people are upping their volume, trying to do more because they're starting to feel pretty good. Then all of a sudden, hits them pretty hard, and we're talking tendinopathies, tendinitises, and those common areas, plantar fascia, Achilles tendon, patellar tendon, maybe patellofemoral joint pain, repetitive irritation through there, iliotibial band, greater trochanter, or gluteal tendon around there, bursitis, things like that. So what we do at MAT in particular is focus on delivering objective testing around how do we assess the capacity for being able to run, right? And a lot of this is based off a lot of those principles of functional performance testing, but we utilise a whole vast array of assessments to try and assess all of those different criteria. And in our MAT course, we talk about those 5 key components of functional performance testing to make sure that we've got a complete profile of our runners and their capacity to be able to tolerate running. So a lot of the things we do on the MAT in particular, right, because half the reason why we designed the MAT was that there are a lot of great tests out there already, but maybe just weren't as accessible as what we would have liked them to be. So often we're doing assessments for the foot and ankle flexibility, such as the Weight Bearing Lunge Test. Particularly we see a discrepancy of 2 centimetres or more on that test is consistent in the research at indicating anywhere from 2 to 2.5 times the increase of a repetitive stress injury or a lower limb injury, so such as your plantar fasciitis cases, your Achilles tendinopathies, maybe things up in the knee. Also really love for a lot of my runners, particularly the STAR Excursion Balance Test in the anterior direction. We think about it, running is mostly a sagittal plane activity, right? Sagittal plane sport. And ideally, what we want to see in our runners is that they are really efficient in being able to obviously handle those forces and direct those forces all in that sagittal plane. Oh, Ed's on. G'day, Ed. And so particularly the anterior reach is a really good one because it gives us a really good insight, particularly at the foot and the ankle and at the knee as well, which are probably where the vast majority of those injuries occur. Other great tests that we perform, looking at hip and lower limb internal rotation, often such an important assessment for flexibility. So look at the ability to load, particularly in that transverse plane. So being able to put a number in terms of the degrees of rotation, particularly through the hip and lower limb using the MAT. So we often find people get pretty limited, pretty restricted in there, particularly if they're doing a lot of running, because once again, the body is trying to maybe hone itself for just that one activity, which doesn't always necessarily lead to healthy function. And then of course, one of the other really important ones that gets neglected is looking at hop testing as well. So particularly being able to look not only in the sagittal plane, so assessing hop power, hop distance, it gives it a really quick and easy way to assess the power component that all runners need. There's going to be lots of impact forces, and their ability to create and absorb that force in a short period of time is crucial. But also looking at their balance and control, particularly with some of those movements. So a really great way to get some insight there on what's their capacity like to generate and absorb the power that's required with running. So there's some of the key things that we look at using the MAT. That's not the be all and end all though as well. We often find particularly that strength testing is really important in these cases. So one of the things that we teach in our MAT course are some of those beginner and initial strength tests that all health and fitness professionals should be performing. G'day Matt, how's it going mate? Good to see you. So one of the things that we find is that so many runners, all they love to do is run, right? They just run. They're running every day, they're not doing much else. The big problem with that though is that running often doesn't help build strength. You might build kind of conditioning of the tissues and particularly build a bit of endurance capacity, but often they're lacking, I guess, some of those more maximal strengths to be able to, once again, tolerate those forces, because the forces are so high, 2 to 3 times body weight. You've got to be able to deal with that. So some of those tests that we look at there are things like your single leg sit to stand, pretty important tests, and there are some good data, some good numbers and some good research around what most people should be able to perform, particularly when we're looking at knee health, as well as then things like your assessments for the calf and the gastrocnemius, what's like the adequate level of strength that each person, particularly runners, should have there, as well as core strength. So important as well for our runners. So I think probably the takeaway here is for all the mat users, for all the and all the potential mat users in the future, right? Make sure with all your runners, you're really assessing their capacity to tolerate the fact that they're dealing with probably 2 to 3 times body weight worth of force, right? What is their capacity to deal with that? So we need to be assessing their flexibility. In many ways, we need to be assessing, their strength, very important. And we need to be also assessing things like their power, their balance, and their control. If we can do that effectively, we can identify what are their limitations, what are their potential imbalances, and where are their risk factors for these injuries that are so common in our running population. That way then, if our runners are avoiding injury, they're going to be more consistent in their training, they're going to achieve better results, whether that be general health and fitness, weight loss, or if you're someone silly like me, training for a marathon towards the end of the year. All right? So that's it from me, guys. Hope it gives you a bit of an idea of some of the things that we do to look at, I guess, our running clients and our running athletes and how we assess them in particular, using the mat and objective data to be able to help them feel better, move better, and perform better. So I'm going to finish off this run. Still got a little while to go, and hopefully might be able to kind of hit the pool out there at some stage. All right, see you guys. We'll speak soon.